Welcome to Toledo Clinic TV, and I am pleased to welcome our guest, Dr. Lawrence Monger. He's an internal medicine physician. Welcome, and thank you so much for being here.
Yeah, thank you.
We want to spend the next few minutes talking about weight loss, and so the first question I have is, why is it important to maintain a healthy weight? Aside from vanity, people want to look good, but it's really a health issue.
It is, it absolutely is. It's a very common concern for patients as they come in and speak with me in the office. It's incredibly important to maintain a healthy weight. There are some estimates that 70% of the U.S. population, unfortunately, either is overweight, obese, or morbidly obese. And so it's a huge percentage of the population. So it's critical. Weight causes high blood pressure, which leads to heart disease. It's the most common reason why we have adult onset diabetes is because of weight and being overweight. It causes strain and stress on joints, on back, on knees. It's just critical to maintain a healthier weight so you maintain a healthier lifestyle overall. So very common complaint. People are in the office all the time talking about it and wanting solutions, wanting to discuss it. How can I lose weight? How can I maintain a healthy weight? And they want answers.
And so when they come to you, what's the first bit of advice that you give them?
Well, we have a long conversation about this. It's incredibly important just to have a conversation with your patient about their weight. One of my first questions is, where do you want your weight to be? What's your weight goal? How much do you want to lose? How quickly or gradually do you want to lose weight? It's just have that conversation about where the patient wants to be. I don't want to put my notions of weight on them. I want them to tell me where they want to be, and then I can give them some answers as to how we get there. One of the first things we talk about their diet. We talk about what they're eating, when they're eating, how frequently they're eating. A lot of people come in talking about intermittent fasting, and we have that discussion. That's one of the later fads. We talk about diets and whether diets are helpful or not, and what types of diets are helpful. At Toledo Clinic, we have some great dietitians, and so I often put a referral in to see one of the dietitians to sit down and have detailed discussions about their diet. The other part of the incredibly important part of the equation is, what's your activity level? How much do you exercise? And so we have that discussion. How active are you? People often come in and tell me, well, their phone or their watch tells them they're getting 7,000 or 10,000 steps a day. And that's the entirety of what they do as far as activity. And so we try to have a conversation about how can we increase our activity level to burn more calories. I often stress to people that it's important to get your heart rate up for 30 minutes. 90 minutes a week to 150 minutes a week is really critical. So if that's feasible with life and with your body, then we try to ramp up to that. So those are some of the initial conversations we have about weight.
So I assume that's the ideal way if you want to be losing weight, diet, exercise.
Yes.
But there's a relatively new class of drugs that was originally, if I'm right, for type 2 diabetes, but
Correct.
We've discovered there are some weight loss benefits. So tell us about when you might want to prescribe those.
Absolutely. Well, when we start to have the conversation about medications, there are some older medications that we've tried to stay away from these days. There's something called phentermine that we used to use to suppress appetite, and it just was fraught with problems. And Topamax. There are some medications we used in the past that just weren't working very well. Ideally, if we're going to start someone on a medication, we'll get at least 5% of your body weight as far as loss goes. These newer classes that you're referring to, they're called GLP-1 agonists. So if you've heard of Ozempic as an example, Mounjaro, those are two of several in that class that help with weight loss. And so they're initially, as you said, they were started for diabetes management. And they do a wonderful job in diabetics of lowering their average blood sugar. We follow a hemoglobin A1C, and their blood sugars drop wonderfully with those medications. As you discussed, we found out that those people that were taking those medications were dropping their weight. And so they've been repurposed, repackaged, and FDA approved specifically for weight loss. And they do a wonderful job of that. Semaglutide, which is Ozempic, is repackaged as something called Wegovy. and it hits one receptor in the intestine. It tells the brain that you're full. It slows down how you process food, and so you get full from that as well. So it has a couple of functions to tell the brain that you're full early, and so you take in fewer calories. The same thing for Monger, repurposed, repackaged as something called Zepbound. And that hits two receptors in the GI tract, and it has even more weight loss. So both of them do a great job of weight loss depending upon how much you want to lose. Both cause you to be full early, tells your brain, tells your body you're full, you take in fewer calories, and it's a once-a-week injection, and it's been a wonderful, wonderful way to help people lose weight. The Zepbound, as an example, we've gotten people that have lost up to 20+% of their overall body weight, and people have been incredibly happy with it. So,
every medication you take has side effects.
Always.
So,
yes.
So what are you finding, and might these medications not be appropriate for everyone?
Well, there have been people who have had to take off the medications for side effects, and that's been few and far between, but some people don't tolerate them. So it's really important to follow the instructions that we give on how to use the medication. You start off on a low dose, and you gradually, over 3 months, titrate the dose up to an effective dose. If you go up too quickly, nausea is a very common side effect. And so some people don't tolerate the nausea and have to discontinue the medication. Because it slows the gut down a little bit, there's been some issues with constipation and some other GI issues. So for some people, they don't tolerate them. The other barrier to these is that because it's for weight loss, some insurance companies unfortunately aren't covering the medications. So cost has been an issue for some people because they're not covered by their insurance. So there are some barriers. There certainly are some side effects that I warn patients about and we watch out for. The vast majority of people have tolerated the medication well and have taken it for quite a few months to over a year now for some patients. So, and weight loss has been pretty dramatic, so it's been great.
Yeah, very important information. We appreciate you joining us.
No, thank you.
Thank you.
Thank you.